and Albert Co., as we talk a little bit about May 20th, our opening, and some of the final findings from our Reopen Connecticut group. Before we get to that, let me just give you a quick summary of where we are in terms of our cases. You'll see that tests performed, another 5,000 tests. We're closing in on 200,000 tests over the next couple of days. Positive cases as a percent went up a little bit, but still trending down overall. Fatalities and hospitalizations, sort of what they are, sadly enough. Let me tell you where we are. As the reopening committee did amazing work, and I've taken their work to heart, and now I'm going to be coming out with our final report over the next 5 days. Their number one principle, our number one principle, my number one principle was public health and safety first. It's not an economic versus a health issue. The two go hand in hand, as you've heard every step of the way, and a particular focus on our most vulnerable residents, because that is the folks who are most in danger of complications, and that's where flare-ups can be most lethal. Science-driven. These are based on the facts. Not only Dr. Ko and the amazing team that he put together, but Scott Gottlieb and Zeke Emanuel. I think you've seen we've gotten the best and the brightest from within the state and more broadly to inform the metrics we need to allow us to reopen safely. Procure and distribute the masks and the gowns and the PPE. You remember what an issue that was going back a couple of months ago. Thanks to some amazing work, we've been able to source material. We've got a 60-day supply. We got shipments going out to our different nursing homes. They've already arrived. And we're going to keep going because I want to make sure we have a stockpile. We could be the Walmart of PPE over the next couple of months, and I think that's not a bad place to be. Choice. Once we give you the starting gate, you're able to go, then you're able to open at your own pace, and you don't have to open unless you feel like you're ready. But businesses must comply with the rules when they do open. I'll tell you that I was just on with the Governors Association, and one of the governors said, I got my malls open, but a lot of the national chains aren't opening up. What's going on? Well, you know, Indra and I have really focused on the small businesses as part of our reopening, but it was interesting the point of view of some of the big chains out there, be they, you know, retail and food and the such. And they just said there's a hodgepodge of different rules depending on what state you're in. So it's a little bit complicated for some of us. We'll wait until you've agreed on all the directions. So that's yet another reason we tend to talk to our fellow governors and work on a regional basis. So if one state says masks are voluntary, another state says masks are required, that's complicated if you're a retail group with stores in lots of different states. So we're working together as governors to come up with a set of protocols, but we've got the best protocols. I think they're clear, and a lot of our folks are following our lead. And finally, dynamic. And this is really important. Everybody says, be clear, what can I do and what can't I do in August? And if COVID was clear, then we could be clear. But it's a fast-changing situation. We just found out about the syndrome that affects kids, something that was sort of new to us up until a few weeks ago. So we got to be dynamic here, and you've got to be nimble. And I think we feel pretty confident going forward in terms of our reopening strategy. But if the world changes, if there's a flare-up in October, like you heard as a potential from our group yesterday, you've got to be prepared to change course as well. And so that's the fifth guiding principle, stay nimble. So here's the list of the sectors that are open. You know, people sometimes forget that we didn't close down a lot of sectors that other people are now opening in their so-called phase one. We kept manufacturing open, and we've been very careful with them, making sure thermometers, making sure they're testing going in, making sure that they got the masks, and they're doing better and better at that. In fact, infections there have been relatively low. Construction, especially outside construction, real estate, utilities, hospitals, those were essential, not to mention essential retail, including food. Those, of course, always stayed open throughout. frankly, under the next item, open under sector-specific rules, so did non-essential retail. We kept that open, but only for a drop-off and pickup, not for going in. As of today, our retail is now open, subject to you following the strict protocols. Restaurants, outdoor only. I think you heard yesterday from Gottlieb and Emmanuel, and even heard from Dr. Koh all along the way, how much safer you are outside. And restaurants are going to be busy, I understand, doing my reconnaissance, but we're also going to be busy following and making sure people follow the protocols there. That'll give your consumers more confidence going in. Offices, they are open, but still, if you can telecommute, do so. Museums, zoos, outdoor recreation. Again, outdoor is so much safer. Hopefully it's recreation for now where you can keep some distance. Hair salons, we had a lot of discussion about hair salons, and they'll be open on June 1st. Next up, business sectors 2 open. And this is where I wanted to give you more guidance and have Indra and Dr. Koh be here to help answer your questions in terms of some of our thinking, the why behind this. Phase 2 is about a month after Phase 1, about June 20th. And we'll be looking at the metrics. We'll be looking at where we are over the next couple of weeks. And that will be really important as we give you the guidance a couple of weeks before June 20th and beyond. You know, accommodation, I think that really means hotels. And me and our neighboring governors will slowly be opening hotels. As you know, to date, they've been for essential workers. Gyms, fitness, sports clubs. Looking at that for June 20th, really focus like a laser beam on the protocols, how to keep you safe. All personal services, that means the nail salons, that means tattoos. Some of the things that we've held off on a little bit, we're focused on the 20th there. Outdoor arts, entertainment, events, up to 50 people. Outside, we think that's someplace we can go safely. I think the rest speak for themselves. We're going to be very careful in movie theaters and bowling alleys to make sure we have safety protocols in place that make sure employees feel safe and you feel safe going back. Phase 3 is a little further off at this point. And Max, you want to get it up on the screen? Phase 3 is a little further off at this point, but I think it's really worth talking about. Phase 3 will be at least 4 weeks from there. That's where we have bars. We'll see about outdoor bars, but indoor bars, Phase 3. Obviously, that's a place where after a drink or two, it may not be quite as easy to socially distance, so we want to focus on that. Indoor big events, indoor venues, spaces, amusement parks, indoors. Those are the type of things we want to focus on in Phase 3, and big outdoor events. Obviously, outdoor, you're much safer. We've got up to 100 people now. We'll give you clearer guidance on that over the course of the next month or so. Okay, the 5 criteria to progress to Phase 2. Number 1, and these are things that Dr. Koh and his scientific team really worked hard on. I think a lot of other governors have been asking about this. Declining transmission, in particular, no net increase in hospital utilization, ICU beds for that week before, a limit less than 100. That's important in terms of trends and in terms of capacity. 2, contact tracing. Every conversation I have with Indra always starts off with the words testing, testing, testing. I think was pretty good. We got up to 42,000 plus in a very quick time. We're going to get up to over 100,000, and that's a key metric for us going forward, because that means not only testing of asymptomatic and symptomatic in the most vulnerable communities and the first responders, but then more broadly to the general population. And contact tracing, make sure that we can do over half of these in less than 2 days. These are some of the metrics we have for Phase 2. Business and social safeguards, again, I think we did a pretty good job of giving you notice, maybe not as much notice as you wanted, but a couple of weeks in terms of the protocols before we opened on May 20th. And we're going to do the same, working with each and every one of these associations for the companies that we said could open on Phase 2. Again, protections for the most vulnerable. Make sure we have all the nursing home tested. Make sure those most vulnerable communities are tested. Corrections are tested. Those first responders, those places, we have a metric in place. We're testing on a regular basis there. And finally, healthcare capacity along the lines of declining transmission, but make sure that no more than 20% of the beds are COVID related. Those are some of the metrics we have as we focus on phase 2, focus on June 20th. You know, as you know, David Lehman has worked very hard on giving consumers confidence, giving your employees confidence that it's okay to go back to work. And that's part of what the COVID prevention badge is all about. That's what this symbol means here. That you've got a metric, you go to the DECD site, make sure you have hit those particular protocols. Know that you're self-policing, you're taking these seriously, and we give you this sample badge that you can put up on the wall. I think it gives your employees confidence, it gives your consumers confidence, and it gives me confidence that we're all taking this very seriously. And secondly, this will also, I think, help focus on compliance and make sure people know how serious this is. That's the self-certification process. And what are the enforcement protocols? And this is important. I look around a little bit. I see, hey, I'm tired of the governor's rules. I think I'm just going to go open my barber shop and stick together. You know, we're a nation of rules. We're a state of rules. Follow the rules. Don't celebrate people that break the rules. Consumers, don't speak out if you see somebody breaking these rules. You can speak out in person, or you can go dial 211 and let us know, and we'll make sure the proper group is there to give a reminder. And if you care about your community, if you care about your family, follow the rules. What else? Enforcement is delegated to the police, the local police and health departments, municipal chief elected officials. Take this seriously, people. I know Josh and his team, Deirdre, they're on with all the local health departments saying how important this is. I know some of the mayors are, feeling politically jumpy and ready to say, to heck with the rules. You can do whatever you want. I'm not going to enforce it. That's no way to run a state. We're working together on this as best we can, and I need your compliance on this. When it comes to salons, we're talking about 10 days, and I hope I can count on you to do this. The enforcement, I've been so proud of the state, as I've said before, has been self-enforced. I'd like to think we're going to be able to keep going that way. We see a light at the end of the tunnel. We see where we are today. We see where we're going to be on June 20th. And I think you see the progress we're making because we're sticking together. And before we take questions from the media, I'd just like to ask Indra Nooyi just to say a few words about the amazing group of people that have assisted you and Albert over the course of the last month. Indra?
Yes, thank you, Governor. And before I talk about the people who worked on the committee, I think there's a very important slide you may have missed, which is the education and community services to open. Is it possible, Max, to put that slide up? Because that's a very important one.
Yes, it is. It is up on the screen now.
Governor, I think you missed the slide.
I did. Thank you. Well, I'll start with this as I missed it. Education and community services to open. This is part of our phase 2 as well. I got to tell you, I've heard from people across the country that really impressed Indra with the amazing educational specifics that your team put together, led by folks in universities, residence halls, and distance learning. And you can see under phase 2, we're focused on youth sports, June 20th, all-day summer camps, June 22nd. These are important. They're outside. That's one reason we think we can get them going now. And it's really important to young families that they have someplace safe they can, their kids can be and start to socialize again, and they can go to work. I'll just go quickly through here. Non-residential workforce programs, non-residential clinical and lab. I think what's interesting there is non-residential. Our education task force felt very strongly that residential would come a little bit later, because residential, you have people living together, a little more complicated when it comes to social distancing. And they'll probably start with residential for the graduate programs. You see that in July and August. And they'll road test the graduate programs for housing and then the undergraduates. And we've told the universities to expect opening up in September with residential housing. But as Dr. Koh says, if there's a change of course, we'll give you about 30 days notice, and you got to be ready if there is a change there. K through 12 summer school as well, starting up on July 6th. And finally, for the fall school year, we are planning on undergraduate residential programs, K through 12. I think you know what our plans are there, and we're counting on that. And finally, boarding schools. They are all going to be decisions we make at a later time, but right now people are planning for the best in that case.
Thank you, Mr. Governor. Yes, thank you very much. And thank you again for giving Albert and me this incredible opportunity to serve the state and co-chair the Reopen Advisory Board, working very, very closely with all of your team from the state. I want to make a special call out first to my co-chair, Albert Koh, without whom this Reopen Advisory Committee could not have functioned. Perhaps one of the finest epidemiologists in the world, and I had the privilege of learning from him and serving with him. The other members of the team who dropped everything they were doing and decided to serve the state and you, Charles Lee from the Jackson Institute, Mahmood Khan, who is the CEO of Life Biosciences, David Shear, the incredible Harlan Krumholz, Alexander Karnal from Deerfield Capital, and Onet Chukwu, all of whom led their pieces admirably through the entire process. It was a bomb run. It took 5 weeks of non-stop work. We worked at pandemic speed, if you want to use that word. And they were ably supported by people who headed up subcommittees, Rick Levin and Linda Lorimer, who co-chaired the Education Committee, Marcella Nunes-Smith, who co-chaired the Community Group, Carrie Redlick, who co-chaired the Occupational Health Group, Karen Van Bergen from Omnicom. Omnicom offered all their services for free to help prepare all the communication material. And finally, I want to make a call out to Peter Denius and Jim Smith, my co-chair of Advanced CT, who both provided great counsel as we went on with our work. The entire team from the state was wonderful to work with, and I hope they were happy with what we did to help them do the work, because at the end of the day, it's your judgment and the implementation capability of the state. We're always going to be there to provide a helping hand, but on behalf of Albert and me, thank you for giving us the opportunity to serve our beloved state and to serve you, Mr. Governor. Thank you.
Well, I appreciate that, Indra. When you say pandemic speed, you work fast to stay ahead of this pandemic the entire time.
Exactly right.
We saw some other countries and places that were overwhelmed, and you did not let that happen. Albert, would you like to say anything? Or we can go right to questions.
Let me just say that it's also been a privilege to serve with Indra on this committee and at your service, Governor, and for the state. And I just want a special call out to Indra for her leadership, not in terms of only what she brought, the experience, her long experience in economy and business, also the part of her humanity, how she's able to have us successfully talk with the health and the economy, and this is a very difficult decision-making process. So I just want to send my special thanks to everybody in the committee and myself to Joe.
Thank you.
Thank you, Albert. Max?
Channel 3 Eyewitness News.
Yes, Governor, we're hearing about some businesses that are defying the orders and reopening, and I know that you did touch on that, asking everybody to stick together. But in these cases where we're seeing businesses defy this order, what is the next step for them?
Do the right thing. I mean, I can talk about enforcement, I can talk about municipal police, I can talk about citations. Do the right thing. It's the right thing for your community. And I didn't really appreciate seeing elected officials sort of egging people on to break the laws and break the rules. I think we got to stick together on this, like I said before. And I've looking around the rest of the country. I've seen some of the enforcement things they've had to do as people try and break the rules or say I'm above the law. That's not the way our state works.
Unmute. Matt Campbell, unmute.
Oh, Governor?
Yes.
Yep.
Yes, we're also hearing about casinos unveiling their plans to reopen on June 1st. Your thoughts on that?
We've got to talk again. I think that's incredibly risky, and it's risky for the people that work at the casinos. It's risky for the people that go to the casinos. It's risky for the region because you have a lot of employees who go back out into the region. I think you heard from Zeke and Scott, the former FDA commissioner and public health expert, saying this is an enclosed area, a lot of older people in there, some of them with pre-existing conditions. Alcohol and food is involved. I'm going to do everything I can to make sure that we put public health first. But maybe, Dr. Koh, you have some thoughts on that, maybe?
Yes, I would strongly second what you just had said, Governor, and also going back to what Ezekiel Emanuel said yesterday. So this situation of the casinos, particularly when we're coming off the epidemic and when we have also high transmission in places like New York City, this is what we call the proverbial perfect storm. You'll have people coming from places throughout the Northeast to these casinos. They're in enclosed areas, and I think we also have to remember kind of the guiding principles of how to prevent infection. One is that indoor is much more dangerous than outdoors. Second is that even if you're socially distanced within 6 feet, the more time that you're spending indoors, have circulation of air, you have risk to the general people. I think thirdly is that we worry specifically the people who are working there in the casinos. These are people who may have underlying medical conditions that place them at risk for severe complications, hospitalizations, and possibly death, and also the people who frequent to come to these places. So I can't stress enough of how we're concerned about that situation, why we've put off other large indoor gatherings out to phase 3. And I think just from a public health perspective, the risk of outbreaks in this type of setting is actually enormous, and they'd have large ramifications as people return to their homes in different parts of not only Connecticut but the Northeast.
Move along next to News 8.
So this is for Dr. Koh. What keeps you up at night is trying to figure out how to go into a changing room and put on clothes or put on shoes and put them back on the rack. What keeps you up at night for the gyms or amusement parks? For example, what's the most dangerous, risky behavior you want to educate people on so they can avoid it when they're sharing equipment or a ride at an amusement park?
So I think going back a step, and our knowledge is changing. We're learning everything we do each day. But it does, at least when we've seen bad outbreaks, or when we see transmission in well-characterized setting, the most important risk is actually between person to person. So somebody standing within 6 feet where droplets have transmitted, somebody who's infected can actually reach to somebody else. There is also the risk of having these droplets land on surfaces and people touching, but we actually feel that those are less risky or actually less cause a lower proportion, maybe even less than 10% of all the transmission that occurs. So the basic principle is to prevent those close contacts that people have, particularly those face-to-face contacts. And I think the second thing, and just to reiterate, this is an important public health issue, is that our message is that outdoors is safer than indoors. Outdoors, where you have a lot of air change, is a mitigating or reduces the risk that people have. So when we think about amusement parks, that and this was in phase 2 in open airs, I think the most important point is to maintain the social distancing. We have the protection of that air change when you're outdoors, we do have to be cognizant of people touching, places that may be contaminated with secretions, whether it's saliva or from the nose. But also we're going to be, concerned about, so those are the major concerns for the outdoors. In the gyms, when you're indoors, I think reducing the time that you're spending indoors, as well as socially distancing, is going to be important. And as you can imagine, people have secretions, they're being, spread, to wipe down, to disinfect in those settings. But in general, I think, if we can limit the amount of time, and these are part of the guidelines that the Occupational Review Committee is going to have, kind of strict guidelines to prevent and mitigate and reduce the risk in those indoor settings, such as gyms.
Thank you. And for youth sports then, if they're coming in contact, like say soccer or baseball sliding in or sharing a ball or something, field hockey, lacrosse, how does that fit in? Because I know youth sports is open on a reduced basis.
Right. So not all youth sports are the same. If you compare, for example, wrestling is, qualitatively different from baseball, or Indra's favorite sport, cricket, where people can effectively socially distance. So those are all the questions that, in order to make this a safe environment for kids, and this is not only in the summer camp setting, but also in the youth leagues over the summer, we have this really great or marvelous group of occupational experts in occupational health. This is the Occupational Review Group, which includes people from the state OSHA department, as well as experts like Harry Redler from Yale University, working together to really come up. And these have to be really tailored instructions, specific instructions, how to keep our kids safe, but also the coaches and the adults that are there. So those are in the process. I would just, keep cognizant. These are ones which that team is meeting daily, going over to come up with those specific recommendations.
Well, and I want to say thank you for your service. I appreciate it. Governor, would you ever get them back together again if necessary?
Yep.
NBC Connecticut.
Governor, with a lot of businesses reopening today, what's your recommendation for workers and shop owners? I guess what's their recourse when they come across maybe a customer who refuses to wear a mask or take precautions? Because I imagine they're all very aware of incidents around the country of some customers having violent, sometimes dangerous reactions to being asked to wear a mask.
You want that one?
Yeah, so I think Commissioner Lehman, when he was here the other day, made a good analogy, which is this is the COVID era equivalent of no shirt, no shoes, no service. If you don't wear a mask, businesses have the right to refuse service. But again, we just remind people, as the governor did, if there are issues that are observed, if there are compliance issues that people are concerned about, to work with your local police departments, local elected officials, or enabled through governor's recent executive order to be participants in helping ensure that rules are being followed in their municipalities. And we do have a complaint form if people want to submit anonymously on our main ct.gov coronavirus website. And of course, you can call 211 and put in referrals that way as well.
Governor, when do you think would be an appropriate time for casinos to begin reopen? Is that part of phase 3, late July?
I'm now talking to my regional governors, because one of the things we want to do is do it at the same time, so we don't have a lot of people from Massachusetts driving or from New York City driving up here. And so we're going to be reasonable. I understand the incredible distress that the casinos are in terms of their economic need, but I also know about the public health issues. So we're going to work this out.
And your thoughts on Cromwell planning to send you a letter asking you to allow small businesses to open as soon as they are ready and able to safely do so, kind of asking you to move that timeline up?
Yeah, I talked to the mayor, and we're one of the first to open up outdoor eating and some of the other things we're doing right now. I don't want 169 towns all, doing their own thing, because that would be a field day for the virus.
And then my last question for the committee, there's always the potential for that second surge this fall. We talk about it a lot. How concerned are you at this point about that? How likely do you think we could avoid it, that and the possibility of it coinciding with the flu, which could make it much more problematic?
Yes. I'm sorry, could you repeat the question? there's some background noise.
Yeah, my apologies. How concerned are you at this point about the possibility of a potential surge?
Okay. Yes, I think that's something that we have to be, always on the safeguard. I think as we explained in previous press conferences, this is a highly transmissible virus. This is a virus that's not going to go away. We're going to have continued transmission. I think, with strong public health interventions, we're going to hope to get the transmissibility so that one person is not able to infect another. This is going to be a hard fight. It's going to take a lot of work. This is all behind the testing strategy and all the supports, the contact tracing, community supports to help people go through self-isolation. I think the resurgence, as you heard yesterday from, Ezekiel Emanuel and Scott Gottlieb, they echo this concern of resurgence. We're particularly worried about what's going to happen in the winter. We have not only other influenza, but other respiratory viruses that come up. And we know that in drier seasons and colder seasons, respiratory viruses actually can transmit more efficiently. But we still have to be cognizant about that threat also during the summer. We have common colds that occur in the summer. And we need to actually remain vigilant. I think one of the most important things that we're doing, reaching that 45,000 or 42,000 level, is that now that we have a robust system to detect a resurgence or an uptake. I think that's probably one of the small victories that we've had in the last several weeks.
WTIC 1080 News. The Associated Press.
Thank you. Governor, good afternoon. You said that you were going to try to do everything that we can to convince the tribes not to reopen. These are sovereign nations. What can you do?
You're a sovereign nation, but you're also part of the great family we call Connecticut. And we've had a great partnership together going back decades. And I've got some of the greatest health experts in the world who have said opening up now endangers your customers, endangers your employees, and endangers the broader community. It's a good time to slow up. We're going to work with you to find a way we can open safely together.
So specifically, what will you do?
If you're saying my bully pulpit may not work, what else can you do from there, which I sense? Look, we have a number of options. I'm talking to people who represent the people that work at these casinos. Do they feel safe going in? We could always advise people driving into the casinos, hey, do you know that the governor has said this is not safe, especially if you're over 65. He has said stay safe, stay at home. These are the sort of type of warnings I think I'm obligated to tell people before they take part in risky behavior.
And I know that the chairman of the Mashantuckets is a member of the reopening committee. Did this come up during your discussions with him, Rodney Butler?
Andrea, you had some conversations, I think, with Rodney, didn't you?
I know Rodney for many years, a good guy. And I think two issues. One, I understand where the casinos are coming from. They have a loss of business, and these were thriving enterprises. At the same time, Rodney and I talked about two things. One is that many people who come to the casinos are older people who we would call vulnerable to this COVID virus. So we are worried about them. And so is Rodney and the tribes. They just think that they can create an environment where they can keep everybody safe, which is, difficult to imagine. The second thing is you bus people in from New York and Boston. And that's the last thing we need in this stage of the reopen. And again, we were assured that they would do this safely, but I think we have to give it some time to see how the early reopening goes before we reopen something as a bigger magnet for the virus as casinos could be. Finally, many parts of the tribe are also diabetic. And people with diabetes are more prone to be affected by the virus. So I think knowing the tribe people, and they're very, very good people, I think they're exposing themselves to more infection than they need to at this point. But again, at the end of the day, whatever the governor chooses to do with the tribes is the right answer.
Thank you.
Boceto Media.
Good afternoon, everyone. Governor, I know that there's been an ongoing question through the whole time of the virtual press conferences that can you advise the way the Department of Labor has been handling unemployment payments? Many people receive their benefits and been having to stop for the last 2-3 weeks, and there's no way to get in touch with the call center.
Yeah, I think the question regarding the Department of Labor and getting their unemployment compensation checks, as you know, we sent out well over $1 billion in payments. We've sent out over 500,000 that have been processed. I think we still have a way to go. I understand what you're saying. There's still been some complaints out there. You got to understand that we got 20 times more applications for unemployment compensation in 1/10 the time than you used to in any other recession. And but I know that doesn't give you any confidence if you've been laid off or don't have a job and you don't have an unemployment check coming in. I think almost everybody has gotten it in, and those that haven't, I know that they are working round the clock to make sure we get that right.
Governor, are you planning to, with the horse fees that have been provided last 3 days? I know perhaps this will help to these emotions that are going on in small cities, that preventing them from being included in the reopening to more buyers and into their clients.
You could take that. I just couldn't quite get it.
I'm sorry. Your audio has been breaking up, so I completely missed your question.
So I'm asking, the governor is planning to meet with the hard sites that been protesting. Many of them said that it's not right that being excluded.
We're going to have to move along. We cannot hear. We are going to have to move along.
I apologize. I just can't understand the question.
You can, Mary Carmen, send me a text message. We'll try to get to your question. Connecticut Mirror.
Good afternoon. Governor, it's been clear that there are a lot of businesses who are pushing for some kind of blanket immunity when it comes to reopening and what they might face as far as liability. What kind of lobbying have you been subjected to in that regard?
We talked about it in the governor's meeting today. I've heard some comments on it with CBIA and others. I think because reopening team has helped us put together protocols that are pretty clear, very clear, clearer than just about any state that I've had evidence of. I think it gives businesses some confidence that if they follow those protocols, follow disinfecting, follow the mask, follow the 6 feet, follow everything we have recommended, that will give them some protection from lawsuits. I don't think there's anything we have to do. I think the direction we gave in our protocols give people some of that legal protection.
Did you get any recommendations from your Reopen Advisory Group on this?
I don't know. Ask them. What do you think, Indra?
Whether we've had lobbying from people to open?
No. Did you or your group give the governor any advice on the liability question, whether the state of Connecticut should do it?
No, we did not. Again, that's for the state to decide. We just talked about how to titrate public health and the economy and provide a framework for decision making.
Thank you.
The Hartford Courant.
Hi, my first question is for Dr. Ko. Dr. Ko, what do you expect to happen with cases and hospitalizations in the next few weeks as we reopen? Is it somewhat inevitable, or at least likely, that there will be some sort of uptick in hospitalizations given that people are out and making contact with each other a little bit more?
Yeah, I think, thank you for that question. So we're going to be going into uncharted territory once we open up from the strong social distancing that actually prevented, a very large, much larger and much more devastating outbreak than we had actually witnessed. So as we are increasing the social contact rate, we're going to inevitably have transmission, and that may translate into hospitalizations. I think counterbalancing that is really the tremendous ramp up the state is doing. Josh Javelle, his team, Michelle Gilman, many of the people on the state have actually made leaps and bounds in increasing testing, and then setting up the contact tracing, and so also doing testing in our most vulnerable populations, whether the correctional facilities, whether the nursing homes, the populations that are most susceptible to epidemics. So my own feeling is that my own judgment is that we're going to have increased transmission as we increase the contacts. We're coming off with strong social distancing, but at the same time we're going to be putting in the mitigation that's needed to kind of suppress that. So we may be in kind of a check and balance situation where we may be fluctuating. We may have some ups, we may have some downs. I think the most important thing is what the governor said earlier, is that we do have a fail-safe mechanism. We go above the criteria that the state feels is dangerous, and which have been laid out by several of the health experts. That's the point where we need to decide about what to do next in terms of increasing back the social distancing that was previously successful.
Thanks. And Governor, I wanted to ask you about absentee ballots. There's been some back and forth between the president and certain governors about this question of absentee ballots and absentee ballot applications. Just wondering where Connecticut is right now, where you are in terms of figuring out absentee balloting for both the primary and also for the general election.
Well, first of all, it's worth noting that the president himself voted by absentee ballot in the last election. We're issuing an executive order today that says if we don't have a vaccine in time for our primary, then you're eligible for an absentee ballot if you feel like your health may be at risk. I think that's the appropriate thing to do. I've got telling people over the age of 65, I'm telling people with pre-existing conditions, stay home, and yet they don't give up their right to vote just because I've got that order there. And as you know, our amazing Secretary of State has got a plan to give people applications for that absentee ballot. I'll be working with the legislature going forward what we can do in November.
Thanks so much.
The Day of New London.
Hi, Governor. First question. We have been hearing from some folks who have tested positive for COVID who have either not heard from a contact tracer at all or have not heard from them for several weeks after testing positive. Could you speak to what the process is for alerting contact tracers of new positive cases? And could you explain whether those contact tracers are going to be working on a backlog, looking at contact tracing for folks who tested positive maybe a month ago, or if they're just going to be focusing on new cases?
I can start on this and pass it over, I think, to Josh. The question is about contact tracing, and I think you referenced a few people that tested positive and have not been notified yet. Well, we are, for all folks going forward that test positive, we're lining up the contact tracing capability, working with our local departments of health. I think we have dozens who have signed up now. We have the Microsoft platform in place. We have hundreds of people who are now beginning to make those calls. Josh, anything else?
Yeah, no, that's right. I mean, I think there's been local health departments since this epidemic started have been doing contact tracing, in some cases very aggressively. In some cases, local health departments have been a little underwater, as you could imagine. And then as the epidemic really crested, contact tracing kind of got overwhelmed, right? And so now as we come down the back of that curve, what we're doing is we're standing up this new infrastructure so that as we come through the summer and we can have the right protections in place, make sure we're isolating contacts and preventing that rebound as much as possible. So the team's been making good progress in the municipalities and the local health departments that don't have infrastructure. We've got the statewide platform is now stood up. We've got over 500 local health department officials registered on that platform, being trained, and starting that process of starting to really ramp up the contact tracing activities, and then the follow-on supports for people who need them that are identified.
Thank you. And then second question, can you speak to what benchmarks will be monitored in terms of what may cause the state to roll back the reopening that we've done so far? Are there certain numbers that you're going to be looking for to make that decision and make sure it's safe to continue with this reopening?
Yes, so that'll be one of the details that'll be outlined in the governor's report that he mentioned that'll be coming out in the next several days. But just to preview that, it's really going to be focusing on that hospitalizations metric that we had for phase 1. The governor just described as in phase 2. It's a more extreme version of that. So if you start to see those COVID hospitalizations really starting to accelerate at the 100 or less benchmark, that may cause us to, or 100 or more benchmark, that might cause us to push off a phase 2 if that's happening. If we go above that to like 200 within a week, that could be a cause to start to roll back. So we will have those metrics in the report.
Thank you.
CT News Junkie.
Thanks, Max. My question was actually how many, what the benchmarks would be in order to pull back a phase 2. So I'm going to ask if the computer outage last night caused any more problems with the Department of Labor system and unemployment claims?
No, Commissioner Westby and his amazing team who are working so incredibly hard through this pandemic, he mentioned to me this morning that they are going to be able to still get payments out on time despite the outage yesterday. The only impact that I think we will see is usually we put out on Thursdays our large comprehensive data package for COVID statistics. That's going to move to Friday this week because the team did lose a day on particularly putting together the latest updates on some of the data sets.
Okay. And so, Governor, who after today, you're disbanding this reopening committee, so who after today are you going to be looking for advice to make these decisions? And would it be helpful to have the legislature back in session?
Sure. We talked to the legislature a lot. I welcome their input. We've been briefing them. I think, Dr. Koh, you've had a number of conversations with key legislators and still stay available. But now I think it's moving over to DSS and our Department of Public Health and our local. We're ready to get this implemented, ready to do this. But we'll always have friends back in the reopening committee when we need some free advice.
News 12 Connecticut. Waterbury Republican American.
Thank you, Max. A question about adult recreation leagues. This is obviously getting into adult softball season. There are all sorts of soccer leagues. When might they be allowed to resume play?
You want to take that?
Yeah, it's a good question. I think we're thinking about it in the same context of a phase 2 reopening, consistent with youth sports, outdoor recreation. But I got to double check that one. Unless Dr. Koh, you remember exactly where we had that slotted.
Adult sports.
Yeah, I think many of the adult sports are actually regulated by, like for example, the Major Baseball things, and so they're going to be coming out with their own recommendations. And I think, one of the issues is to wait for those to come out so they can see where they fit in. Obviously, we're worried about adult sports or outdoor, even the outdoor setting, because you have people, the fans getting there, they're yelling and they're shouting. We know that, when you're shouting, singing, you're yelling, you have projection, the air droplets, actually, many feet way beyond the 6 to 10 feet that we usually use as a benchmark. So we're going to be waiting for those kind of the recommendations from those professional leagues before we start thinking about how to take steps forward to ensure safety in those settings.
When someone is returning to work, can an employer make an employee take a COVID-19 test?
Yeah, in many cases, yes. Employers have in certain settings, have an obligation to provide for a safe workplace if it's deemed critical. Some employers are doing this voluntarily. It's an issue that we are looking at in certain circumstances.
The inverse of that, I'd say, Paul, is that at Electric Boat, the employees who worked there wanted that test. They wanted that sense of security to know that not only they were safe, but the people around them were safe.
Well, say, what about someone who works in a hair salon and their employer says you have to sign this disclaimer form and you have to get a COVID-19 test? Is that something that can happen?
I think I got to get back to you on that. I haven't heard of that particular requirement, although, frankly, I'd want to take the test. And I'd like the fact that my fellow employees were taking the test. And I like the fact that customers were coming in, maybe had a fever test on the way in, so that I would give me a greater sense of confidence. But if there's a type of objection, I got to look into that.
Okay. And what about summer rentals? You've got a cottage down on the shore, you want to rent it out for a couple of weeks. This is the season to do it. Will people be able to, do short-term summer rentals?
Yeah. Well, as you know, going back now, I think it was a couple of months, we said hotels only for first responders and no short-term rentals, a month. At that point, this is going back a couple months, we were really worried about out-of-staters coming in. I think we're going to take a second look at that on June 20th as part of our second phase. One of the reasons we're taking a second look is the differentials between, New York, Westchester County, Massachusetts are a lot less now. So there's less risk of some of those folks coming in for a rental, but we still say self-quarantine a little bit just to check.
Move along next
This will be the last one. Have you heard anything that gives you concern today from any state agencies or local agencies regarding the reopening?
I have not heard any concerns. I know there's been more traffic on the road. I know that some of the buses are a little bit busier. People, going to the restaurant, going to some places, but I think it's going pretty smoothly. Paul, have you heard anything?
Haven't heard anything of the type. We also just going to keep telling people practice safe social distancing and wear your mask, even though we're going through our various phases.
Connecticut Public Media.
You've been talking with the casinos frequently, you've mentioned. Did it come as a surprise that both their websites say they're opening June 1st, or was there an inkling of this coming over the last few days?
Inkling. I mean, I knew that they very much wanted to open, strong economic reasons. To their credit, I knew that they were thinking thoughtfully about how they can try and do this safely. But I think they also knew that I thought it was too early and dangerous.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. Maybe I guess I didn't understand what the accommodation means. Is that hotels or in your list of phase two?
I think it's a fancy way of saying hotels, and I think we sort of answered that before.
Thanks. Would you recommend or would you agree that somebody who wanted to plan a July 4th party should go ahead and try to plan it now, or is it still too early?
We're going to have pretty clear direction over the course of the next couple of weeks, what happens on June 20th and beyond. I think we've got some preliminary numbers there for outside events, but give us a couple of weeks just to see how this first phase is working out.
Thanks. And also, one of our reporters is working on a group of religious leaders who were, A, frustrated that they were not on the advisory group, and B, would like some kind of carve-out so they can go back indoors and have religious services for X number of people. How does that fit into your plan?
If you love your flock, hold off. Whatever your worship service is, it tends to attract older people. They tend to be, closed in. As Dr. Koh just said, it often involves singing, which projects potentially COVID germs. It's my strong recommendation, and it's our rule that, look, religious services up to 50 people. We gave them a little more latitude, just especially for those larger facilities where you can spread out and be safe. Obviously, outdoor services, more latitude. Zoom services. I think we need a little more time if you really care about the people going to your services.
And I'll also add the individuals that you referenced in that letter were individuals that were gathered and actually convened by the governor. That's how they all came together. And their information and the discussions that they had with various members of our teams, including the governor, myself, Jonathan Harris, David Reyes, and others, was passed on to our reopen committee. Went through the OSHA process. I know Dr. Koh participated in a teletown hall with the same various individuals. We have been very responsive to them. And I'll also add that we also have other religious leaders who are saying it's too early. And we've also received those letters as well. So we're doing the balancing act, but also making sure public health and safety, as the governor has stated and what Dr. Koh has stated, is first and foremost.
And finally, Governor, have you given any more thought to the presumption of workers' comp for essential workers? AFL-CIO asked that a couple of weeks ago.
Yeah, my understanding is, for hospital workers, that's something they deserve. I think for most everybody else, we have a workman's comp process. It's pretty clear. If you're in a facility where there's a lot of COVID and you think you caught it there, you go through that process, and you get your workman's comp. I'll say one thing ironic, though. I was just watching a comment by Andrew Cuomo that, in fact, those frontline workers at our hospitals were the folks least likely to have a high infection rate during some of the first randomized testing in New York over the last few weeks. And it just reminds you the importance of wearing a mask.
Yeah, I think that the AFL-CIO was talking about grocery store workers and the like also.
I think they go through the normal workman's comp process.
Thanks, Governor.
Thanks.
Going to ask a question from Boceto Media from earlier. Governor, are you planning to meet with hairstylist groups to ease the distress of protests? They have been visiting their clients at home, which is exposing them and their clients to get infected due to the limited safe measures as if they were in their salons. Do you have any response to that?
Yeah, well, I can certainly say that I did a teleconference with hundreds of folks who own salons, work at salons, hairstylists, and I understand that they needed time, A, to prepare the salons, B, time in terms of child care, and make sure they had all the necessary PPE ingredients to make their work environment safe. And that's why we went from May 20th to June 1st. We took that to heart when I heard those comments.
And I'll also add that myself and David Lehman participated in a teletown hall with African-American beauty salon owners and barbershop owners led by the NAACP. And while many of them were looking forward to May 20th, I had one particular barber who said, while I had many people who were set up to for May 20th, I was actually scared. And that's a very telling sign that we've been hearing from people, that some people have been scared to say that they needed more time. And for those who did speak up, we thank you. And as we go through this process, we want to make sure that everyone is prepared as we go forward. Not only the salon owners, barbershop owners, but their customers.
Fox 61.
Hi, Governor. Zinnia Maldonado with Fox 61. What's your take on how today has gone? It's the first day of reopening. Would you call it successful?
I think I would. To me, successful was people having faith that we've taken care of the public health aspects, that when we say it's okay to go to a restaurant outside, they understood that it was safe, and people are getting tiptoeing back in. And I haven't heard of a lot of defiance out there. I think people feel like we're on the right track, and I appreciate that.
And could you talk to us a little bit about this self-certification process? Is it going to be required for businesses to do this? And will owners be relying on that small business manual to check off what they should be doing? How do we know some businesses won't self-certify themselves without actually hitting those marks to make consumers feel safe?
Well, self-certification means they know what the protocols are. They've had to check that they followed the protocols. But you're right, I'd like to give myself my own grade when I was in school. But you also have customers coming in and you have employees coming in, and they are double checking as well. And customers aren't going to feel comfortable if they see those protocols aren't being followed. And as Josh and I have explained, there are a number of ways you can go to make your case heard, starting with the 211 number. So I think we have a number of checks and balances there to make sure you're safe and your employees are safe. I think Max just gave me the signal. So let me just say two things. You know, Albert and Indra, the team you represent and what you've been able to describe to the people of Connecticut over the last 5 or 6 weeks, I think give people confidence. I think they know that we put health first. We know this was a not political process. We know it was a serious process. And I cannot thank you enough on behalf of the people of Connecticut. And in terms of the other question, how did this first day go? I think it went well because people had confidence that we were giving them the best direction with as little politics as we could. I heard a number of questions about, you know, some people think we're going too fast, some people are going too slow, the defiance out there. You know, follow the rules. This is Connecticut. I think we know what we've accomplished today. One of the first states to take these baby steps going forward, as Indra said. I think you see where we're going to be in 2 weeks, where we're going to be in a month and going forward. And for those of you who are very frustrated, I know there have been a number of demonstrations out there expressing that frustration. I think most of the demonstrations have been incredible. They've been sort of Connecticut demonstrations. People wearing the face mask while they protest some of the protocols. But I was informed that there was a demonstration here at the Capitol yesterday where some of the demonstrators acted brutally and got in the face of a couple of the journalists. And get in the face of a journalist in the middle of a pandemic is not the way we do it in Connecticut. We can all do better than that, and I think we have. Thanks, everybody.